This session is on coastal climate sensitive diseases and public health problems. This presentation will include climate change and coastal areas, vulnerability of the region in climate change and human health context, how health related problems are there in this region pertaining to climate change and human health, the function of health sector, things to do and how the things are to be done in the context of climate change and human health, and multi-sectoral engagements under National Programme for Climate Change and Human Health. This map depicts the coastal states of India. The list of coastal states are as follows: Gujarat, Maharashtra, Goa, Karnataka, Kerala, Tamil Nadu, Andhra Pradesh, Odisha and West Bengal are the coastal states in India. The coastal union territories include Daman and Diu, Dadra Nagar Haveli and Puducherry. The island territories are Andaman and Nicobar Islands and the Lakshadweep Islands. Coming to the risk mapping and vulnerability of India, the Indian coastline surrounds 7,517 kilometers, which includes a mainland area of 5,423 kilometers and an island area of 2,094 kilometers. About 14% of Indian population are residing in this coastline. This includes 9 states, 3 union territories covering a total of 96 districts. India is surrounded by Bay of Bengal and Arabian Sea. Bay of Bengal is more prone to floods in comparison to the Arabian Sea in the ratio of 4:1. The level of risk varies between districts. 12 districts are at a very high risk of cyclones or floods, while 41 districts are at a high risk of floods and cyclones. Major cyclone related damages are contributed to strong winds, heavy rains with combined effect of storm surge and astronomical tides. 3 factors are mainly considered for vulnerability assessment for climate change in the coastal regions. First one is the nature and magnitude of climate variability and the change. Second is the human capital and natural assets that will be exposed to and impacted by climate change. The current capacity of coastal communities and ecosystems to adapt and to cope with the climate impacts. There are multiple health related problems in this region in the context of climate change and human health. The main health related problems are vector-borne diseases, waterborne diseases, cyclone related issues, food and water shortages, mental, nutritional, infectious and other health effects. First, let's start with vector and rodent-borne diseases. The impact of climate change on vector or rodent-borne diseases are dependent on the temporal and spatial changes in temperature, precipitation and humidity that are expected to occur under different climate change scenarios, which will affect the biology and ecology of vectors and intermediate hosts, which consequently leads to the risk of disease transmission. Arthropods depends on the climate to regulate their internal temperature for their survival and development. Hence, when there is a change in the climate, the risk of transmission increases. The role of environmental factors on vector-borne diseases. Most of the transmission occurs when the temperature range between 14 and 18 degrees Celsius at the lower end and 35 to 40 degrees Celsius at the upper end. Change in rainfall levels and seasonality, cyclones and flooding, rising sea levels lead to vector-borne diseases. Mosquito species are mainly responsible for transmission for most of the vector-borne diseases. Example, malaria, dengue and schistosomiasis. These species are sensitive to temperature changes at immature stages in the aquatic environment and as adults. The role of human factors on vector-borne diseases. First is the location of the population. Depending on the geographical location, they may be more prone to vector-borne diseases. If they are proximal to water bodies, the risk is higher. Second is the urban environment, where we can see a more of peridomestic breeding. Third is the mobility of the population. Arrival of infected people and living standards could influence the prevalence of vector or rodent-borne diseases. Water hoardings, dams, irrigation can also lead to breeding of these vectors. This map depicts the risk of malaria in Andhra Pradesh. The map on the left depicts the district-wise distribution of malaria cases between the period 2014 and 2016. Darker green parts of the map depicts lower proportion of malaria cases, while the red depicts the higher proportion of cases. On the right is the map depicting the malaria risk prediction based on the CHCs and PHCs. Meteorological variables like humidity, rainfall, temperature and physical factors like elevation, vegetation and water index are included for this mapping. On analysis, they found that regions having higher daily minimum temperature reports more number of malarial cases. Daily rainfall between 4 to 5 centimeters also had a positive impact on the malaria count. This risk assessment will help us prioritize actions at the PHCs and CHCs in preventing these cases. Next group of diseases are the water and foodborne diseases. Impact of climate change on food and waterborne diseases are mainly due to alteration in temperature. High temperatures can alter pathogen survival, replication and virulence. Heavy rainfalls, floods or cyclones can mobilize pathogens from one place to another, compromising water sanitation. Drought can concentrate pathogens in limited water supplies. The Intergovernmental Panel of Climate Change, that is the IPCC, states that there is very high confidence that increased risk of food and waterborne diseases can be expected if climate change continues as projected across the representative concentration pathway scenarios until mid-century. This figure represents how India is vulnerable to flooding. As per the Global Assessment Report on Disaster Risk Reduction, about 2% of India's population are exposed to flood. However, if we see the absolute number, India stands second after Bangladesh with a total of 1 crore 60 lakh people being affected by flood per year. Water and foodborne diseases. Infections are transmitted via water includes pathogens such as virus, bacteria, helminths or protozoans. This can lead to several diseases like diarrhea, fever, flu or neurological disorders or liver damage, which is very rare. The most common waterborne disease is the diarrheal disease. Diarrheal diseases are caused mainly due to insufficient or unsafe water. Climate change has the potential to alter the disease distribution and incidence of such diseases. Diarrheal diseases is the second leading cause of death in under 5 children in India. This also could lead to impaired growth and cognitive development. Morbidity and mortality due to diarrheal diseases are declining. However, this may slow down the downward trajectory because of climate change. Some examples of waterborne diseases are cholera, shigellosis, legionellosis, giardiasis and hepatitis A. Now let's see the post-cyclone effects. Landslides, storm surge and flooding are the most commonly seen post-cyclone effects which could cause major damage to the lives and property. Poorly built construction and low-lying areas are the most vulnerable to such post-cyclone effects. Several health problems are seen within the first 4 weeks of post-cyclone. There are chances of infectious disease outbreaks like cholera or leptospirosis because of lack of sanitation post-cyclone. At this point, it is very important to seek help from the local health facility to tackle such situations. There is always a pattern and timing of illnesses encountered in the post-cyclone setting. In the list, first is the waterborne infectious disease outbreak. This peaks at day 5 and falls by week 5. That is, waterborne diseases are more prevalent between day 5 and the end of week 5. Examples of certain waterborne diseases are diarrhea, cholera and shigellosis. Acute respiratory diseases is one of the commonly seen post-cyclone effect. This majorly affects the children. The risk could increase if there is overcrowding, such as being in camps, temples, etc. Third could be vector-borne diseases. Once there is recession of floodwater, there will be pooling of stagnant water, which will lead to vector multiplication and hence cause vector-borne diseases such as malaria. We can also see exacerbation of NCDs and chronic illnesses. You could see a modest increase in incidence of NCDs and worsening control of chronic illnesses. Injuries are most commonly seen after cyclone. The number of injuries increases up to 4 weeks post-cyclone. It is mainly caused because of uprooted trees and electrocution. Apart from this, people also could face certain mental health disorders which are more commonly seen between the first week and 3 months. People could have depression, adjustment disorder and sometimes even attempt to suicide. Other health related problems encountered in post-cyclone setting are undifferentiated febrile illness, skin and soft tissue infection, bites and stings from insects, scorpions, snakes and animals. This could last up to 4 weeks after storms. Post-traumatic stress disorder and other chronic mental health issues are some long-term effects of post-cyclone, which could last up to 5 years after cyclone. Outbreak of vaccine preventable diseases in congregate settings. Though there are no empirical evidence, there is a potential risk of vaccine preventable diseases during the outbreaks. Effect of food and water shortages. Impact on food shortages. Alteration of survival and multiplication rate of some foodborne pathogens could affect the food production by itself. Approximately 25 million additional children are projected to be malnourished by 2050. Huge impact of such conditions are predicted, particularly in lower middle income countries. Unsafe food creates a vicious cycle of diarrhea and malnutrition, threatening the nutritional status of the most vulnerable. Where food supplies are insecure, people tend to shift to less healthier diets and consume more unsafe foods, in which chemical, microbiological and other hazards pose health risks. Challenges faced in farming. Increasing temperature and change in precipitation has already resulted in adaptation of different cultivation procedures by the farmers. Some of them are crop diversification, mixed crop livestock farming system, changing planting and harvesting dates, using drought resistant varieties and high yield water sensitive crops. However, introduction of such new crops and cultivation methods could also increase the risk of introducing foodborne diseases that people and health system are not familiar with. Challenges faced in livestock cultivation. Introduction of breeds less susceptible to heat may help out, but this change may increase the susceptibility to certain pathogens. In some areas, more animals may be moved inside in an attempt to avoid heat exposure and stress, giving an increased opportunity for transmission of such diseases. Conversely, increased temperature will increase the length of grass growing season in some areas, which could allow more extensive livestock grazing and greater exposure to vectors and wildlife. Effect on water shortages. Glaciers form the main source of water for key perennial rivers. Almost 67% of the glaciers in the Himalayan mountain ranges have retreated in the past decade and will continue to retreat, leading to water shortages. With a rising sea surface temperature of 2 to 4 degrees Celsius, there is the possibility of a 10 to 20% increase in cyclone intensity. So, what are the issues due to water shortage? The first sign of sea level rise, the subsequent submersion of coastline and the destruction of ecosystem and biodiversity are visible. Low-lying areas and coastal megacities such as Mumbai, Kolkata and Chennai are suffering from increased erosion and the loss of coastal protection from ecosystems such as coral reefs and wetlands. Rising seawater temperatures have led to large-scale coral bleaching along the Indian coastline. Overuse of groundwater led to increased arsenic content of groundwater. Next important aspect is the mental, nutritional, infectious and other health effects. There are several health implications post-cyclone or post-disaster. Drowning and injuries are most commonly seen during the time of cyclone and floods. When a person comes in contact with polluted water, there is a chance of wounds getting infected and to other infections like dermatitis, conjunctivitis, gastrointestinal illness, ear, nose and throat infections, and also possible to have some serious waterborne diseases. Increase of physical and emotional stress leads to increased susceptibility to psychosocial disturbances and cardiovascular incidents. Damage to water supply system, insufficient supply of drinking water and insufficient water supply for washing could lead to possible waterborne infections such as enterogenic E. coli, Shigella, hepatitis A, leptospirosis, giardiasis and Campylobacter. Disruption of transport system could lead to food shortage and disruption of emergency response. Underground pipe water disruption, dislodgement of storage tanks, overflow of toxic waste sites, release of chemicals, rupture of gasoline storage tanks may lead to fires. Possible psychosocial disturbances could be because of the death of a family member or a friend. There could also be psychosocial disturbance when there is a loss of job or property. All this could together lead to disruption of the social networks. Cleanup activities following calamity also could have some health implications because of electrocutions, injuries, lacerations and skin punctures. Now, let's see what are the action points to control or prevent these illnesses. The first and the most important step is disaster preparation or the preparedness. Each district should formulate specific guidelines with action points to be taken during the time of disaster. This also should contain the contact name and number of the key stakeholders based on previous experiences during the time of disaster. The district should be linked with IMD, that is Indian Meteorological Department, and the NDMA, that is National Disaster Management Authority, to get information regarding the impact of disaster. Coming to delegation and coordination, we should make sure that each stakeholder is assigned with their own roles and responsibilities. These activities should be coordinated to ensure good information flow between the stakeholders. This team should regularly supervise and monitor the available infrastructure to know what are available and what is needed in addition to the existing resources. The integrated health information platform needs to be set up in each district and have to be updated on a regular basis. Trigger levels during disaster situation for each disease pertaining to each geographical location can be updated to this portal, which will aid in enhanced surveillance. Apart from these, all the stakeholders should undergo training as per the NDMA guidelines, and IEC materials needed during this time should be kept ready in collaboration with the state IEC department. There are multiple stakeholders involved in this activity, and this is the list of all the stakeholders. Now, let us see about their roles and responsibilities one by one. First in the list is the Indian Meteorological Department and the regional meteorological centers. The main role of this department is to issue cyclone alerts. They have to issue these alerts before the cyclone with sufficient lead time. Next is the government hospitals, CHCs and the PHCs. The role of government hospitals, CHCs and PHCs is to make the healthcare facilities and hospitals structurally safe and functional in the face of cyclone to ensure uninterrupted healthcare delivery during the preparedness phase. Their responsibility is to have a contingency plan to ensure adequate healthcare workers, consumables, electricity, oxygen, water, food are available at the healthcare facilities in the post-cyclone period. Next is the role of private hospitals. The main role of private hospital is to provide healthcare delivery during the response phase. Next is the district hospital. District hospital should focus on providing mental health care services during the recovery phase. The role of 108 ambulance services is to provide field deployment services and to deliver medical assistance. They are very much needed in the response phase of this post-cyclone. Training 108 ambulance services personnel in disaster-prone districts to attend to minor ailments in post-cyclone settings is very important. NGOs working in the cyclone-prone districts should provide community linkage for mental health services during the recovery phase. They have to identify and assist persons' mental health needs to avail medical care in post-cyclone setting. The State Disaster Management Authority and the District Disaster Management Authority has the responsibility to combine cyclone hazard proneness with the local data on vulnerability during the preparedness phase. The non-health sectors should take measures for cyclone risk reduction during preparedness phase. Implementation of cyclone disaster risk reduction measures as outlined in the National Disaster Management Plan 2016 under cyclone and wind risk mitigation. The Ministry of Health and Family Welfare plays a vital role in the response phase. They have to mobilize medical assistance in case if requested by the states. The NDMA, National Disaster Management Authority, should make sure the healthcare facilities are resilient to the effects of cyclones. The main activity will be during the preparedness phase. Community-based disaster management approach is important to strengthen the ability of communities to manage and cope with cyclones by training the panchayat, self-help groups, NCCs, NSS, youth, local community organization and volunteers. District health services play a role in making hospitals structurally safe and functional in the face of cyclones to ensure uninterrupted delivery of health services. Their main activity is during the preparedness phase. Contingency planning is required to ensure adequate healthcare workers, consumables, electricity, oxygen, water, and food availability at the healthcare facility in the post cyclone period. State government or UT administration must issue cyclone alerts to health services. They have to issue this alert with sufficient lead time. All alerts to State Disaster Management Authority should be accompanied by simultaneous alerts to the State Health Department. State government and UT health services should create and maintain a repository of health facilities. Their main role is during the preparedness phase. They have to create and maintain a district level repository of public and private hospitals and other health facilities with details of staff, bed, equipments, and services that are available. They also have to identify, train, and assign healthcare workers posted in the adjoining districts to offer medical assistance when required during the post cyclone period. The State Public Health Department has a main role in training the healthcare workers during the preparedness phase. Training of healthcare workers is important to manage cyclone related health problems. Once the disaster has occurred, the response should be initiated by the health team. Following this, the activities needs to be coordinated between multiple stakeholders to regulate volunteer action related to health and health services. In the phase of recovery, we have to strengthen the surveillance so as to pick up any health event or outbreak happening in the community. We have to alert and initiate any outbreak response based on the reporting through the IHIP portal. Outbreak investigation in case of outbreaks that mostly happens during the recovery phase should be reported. Report on activities done by the health team during the disaster and the lessons learnt should be documented and submitted to the respective authorities. Next important aspect to deal with the disasters are the logistic requirements. The logistics required at the healthcare facilities have to be kept ready during the disaster. These are the list of equipments, essential and desirable kits, reagents, drug, etc. that would be required during the time of disaster. Here are the list of the health problems and the consumables that we would require during the time of disaster. First is the waterborne infections. To manage waterborne infections, we would require ORS, zinc tablets and IV fluids. Apart from this, we would require chlorine tablets for water disinfection. We also require hand sanitizers and soaps for hand washing. To manage the acute respiratory diseases during the time of disaster, we would require antipyretics, antihistamines, antibiotics, bronchodilators, nebulization equipments, masks, hand sanitizers, and also IECs on cough etiquette. To manage undifferentiated febrile illness, we would again require antipyretics, IEC on the danger signs, guidelines on treatment, and point of care diagnostics. Skin and soft tissue infections could also happen during the time of disaster, for which we would require local antibiotic creams and dressing materials. To manage vector-borne diseases, we would require RDK for malaria, doxycycline for scrub typhus. Apart from that, we would also require personal protective measures and adulticide. For intermediate and long-term effects, we would need larvicidal and adulticide to kill the mosquitoes. The next health problem that we would face is exacerbation of NCDs and chronic illnesses. Osteoarthritis may exacerbate for elderly, so we would require analgesic ointments, hypertensive and anti-diabetic medications, BP apparatus and blood glucose estimations. Next health problem is injuries, which could include contusions, lacerations, puncture wounds, corneal abrasions, infected wounds and major traumatic injuries. Hence, we would require dressing materials and TT injections. This includes anti-stake venom, parasonin for scorpion sting, antihistamines and steroid to manage anaphylaxis due to insect bite, anti-rabies vaccine for dog bites. People could also face acute mental health problems. Hence, we would also require mild sedative for managing anxiety and depression. The other health problem is the post-traumatic stress disorder and the other chronic mental health issues. This would require a long-term action using psychotherapy. Outbreak of vaccine preventable diseases in congregate setting is required. Here we would require cold chain equipment, generator for maintaining the cold chain, routine immunization to be started in the area as early as possible, and we should also check the cold chain and it should be maintained. We also have to have drugs in case of any AEFI. So, to conclude, coastal regions are highly sensitive to climate change. Health adaptation plan of the subject area, central and state level, needs to prioritize to address the health related issues of the region due to climate change. Under NPCC-HH program, JIPMER as Centre of Excellence and state nodal officers and district nodal officers from the region with the other experts need to work out on the timeline and targets for increasing adaptation and resiliency development of the health sector in these hilly areas. The state nodal officers and the district nodal officers have a great role to play in climate change. Thank you.